In today's video, we'll learn about azithromycin, how it works, uses, dose, side effects, and safety advice. Azithromycin belongs to the class of macrolide antibiotics. It prevents bacterial growth by interfering with their protein synthesis. Azithromycin is a broad-spectrum antibiotic with increased action against gram-negative bacteria. Its uses are to treat many different types of infections caused by bacteria, such as respiratory infections, skin infections, ear, eye infections, and sexually transmitted diseases. Some of the common side effects are vomiting, nausea, abdominal pain, diarrhea. It is contraindicated if the patient has non-hypersensitivity to azithromycin, or if you ever had jaundice or liver problems caused by taking azithromycin before. Use with caution in renal failure. Dose in community-acquired pneumonia, 500 mg, single dose day 1 followed by 250 mg once a day on days 2 to 5. This dose is applicable for tonsillitis and skin infections as well as for COPD. For gonococcal infection, 2 gram orally once. For chlamydia infection and cervicitis, 1 gram once. Now, some of the safety advice: take azithromycin exactly as prescribed by your doctor. Almost all antibiotics, including azithromycin, can cause diarrhea. Call your doctor if you have severe diarrhea before taking antidiarrheal medicine. If you have an abnormal heart rhythm, consult your doctor before use of azithromycin. And that's all for this video.